medical care gaps? What are they? And why are they important for your health, happiness, and survival? To understand medical care gaps, you need to first understand what are national standards. For any chronic medical problem that you may have, be it diabetes, be it high blood pressure, asthma, high cholesterol, heart failure, and so many more, for all of them there are certain standards which are called national standards. These standards are written by experts and doctors in the field, and nobody really benefits from writing these standards, not the pharmaceutical company, not the HMO, but these standards are purely based on the past experience or evidence in medicine that has been published. To give you a similarity to how standards work, when you drive a car, there is a standard that your wheel should have so much pressure of air so that your car can run smoothly. If the pressure is less, there will be traction, drag on the car, and it will not work well. Similarly, there are standards in medicine for various chronic medical illnesses, and if they are not followed, your body will suffer, and this suffering manifests itself as more emergency room visits, more hospitalizations, more disability, and even early death. Let me give you some examples. Many years ago, they saw that diabetes causes blindness, so diabetics, if they have diabetes for some time, they become blind. So they recommended a national standard that every diabetic should have an eye exam. When lasers came, they could now stop the bad effect of diabetes in the eyes and could prevent blindness. So the standard was changed to that every diabetic should have an eye exam every 2 years. Later on, they saw that if you wait for 2 years after the first exam, some people still develop changes by 2 years which are difficult to treat. So the standard was changed to that every diabetic should have a yearly eye exam, and so now the national standard is that every diabetic should have a yearly eye exam. There are similarly hundreds and hundreds of standards for various diseases and also for wellness and prevention. There is a standard that breast cancer screening mammography in females should start at 40 years of age, because the evidence showed that if it starts at 30, then there is more damage to the body through radiation from the X-rays that are needed to do the mammography, and if it is started late, say at 50, then we miss more breast cancers. So after a lot of evidence, they came to the conclusion that it should start at 40 years of age, and that is a national standard. Now nobody can challenge these standards unless there is a reason in your particular case, like you have a family history of breast cancer, then your mammography can be started earlier, or if you are pregnant at the age of 40 years, then it could be slightly delayed. But barring those conditions, the national